Are you a baseball player looking to improve your mobility so you can have better throwing mechanics and have less stress on your arm? I'm going to go over today several exercises that you can do to improve your hip-shoulder separation and why you need to be doing them. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, and I have helped countless baseball players, primarily pitchers, get stronger and back to throwing pain-free after an injury. So I want to talk today about hip-shoulder separation. It's a common term used in the pitching world when we're talking about mechanics specifically. So in a nutshell, hip-shoulder separation is your ability to have separation from your throwing shoulder and your back hip, primarily when you are pretty much right after front foot strike. So when we have front foot strike, we want to get to the point where our hips are rotated through, but we have rotation in our upper back, our thoracic spine, and our arm is up into 90-90 here. We're not in full layback, but we'll be able to hold this position. So for a right-handed pitcher, it's the ability to have your hips rotated towards home plate, but to have your upper trunk facing, in this case, as a right-handed pitcher, third base with your arm up in 90-90 here. So the reason being is that if you're able to create that position where you have those hips rotated through and your arm back here, you're going to have a lot more separation between your shoulder and your hip. And what that allows, it helps create more of a sling and keep your arm moving in unison, in sync with your body. What happens sometimes is if guys have early trunk rotation, that arm can lag behind them, and the arm's either going to lag behind here or it's going to end up pushing forward like this. So that's one of several different reasons as to why we want to make sure we can get into that position. But really the biggest prerequisites that I see for this position are you need to have a stable front leg for a lead leg brace. You need to be able to have sufficient hip mobility to rotate into your hip. But the other side of that is when you have rotation in that hip, you need to have enough thoracic mobility rotation to hold this rotation here. And then from a shoulder standpoint, you need to be able to have good scapular rotator cuff strength and endurance to hold into that 90-90 position. But for the purpose of today, I want to talk specifically about the ability to work on improving that thoracic spine rotation mobility and then syncing it up with some shoulder work to really just to hammer home that position. So first thing we're going to do a rear foot elevated quad stretch with some thoracic rotation. So you're going to take a bench, a couch, start lower on start on a lower height before you progress to anything higher. But I'm going to start here. My back foot is going to be on this elevated surface here. My front leg is firmly planted on the ground here. I'm going to squeeze that back glute. So what I want to think about is not those hips opened up this way. If you have a headlight on the front of each of your hip, I want you to focus on those headlights being forward like this. So I'm facing directly forward here. I have a little bit of squeeze in that back glute, just gentle enough to feel a stretch on the front of the hip here. I'm going to have both hands out in front. And then from here, I'm going to keep my left hand facing forward. And then my right hand, I'm going to rotate back. Now, as I rotate back, what I don't want is those hips opening up. So I only want us going as far as we can while keeping those hips forward. So you're going to see I'm not going to be able to go as far, and that's okay. So I'm going to come back here and then go back. And if you really struggle with using too much of your shoulder versus your spine, you can put your hand behind your head like so, rotate, and back. Okay, so that's one way that we're going to work on just priming that hip-shoulder separation more than anything. The next exercise we're going to do is going to be more of an active exercise to work on putting all this together. So we're now going to be on a knee. You can use, I have about here a 2-pound weighted ball. You can either start with a baseball, gradually build up to a heavier ball like this. That's totally fine. But we're going to go ahead. We're going to get in that hip forward position here, back glute is squeezed, and then I'm going to rotate back like so. Now the biggest thing here is not letting that arm dip below 90. We want to keep that arm at a 90-degree angle here parallel to the floor. My shoulder blade is squeezed down and back. I'm not letting that shoulder pop forward. And then from here, I'm just working into that 90-90, moving up, moving down. So the biggest thing is as you're rotating up, you're not letting that elbow pop forward here. We want to be able to get into this position pretty easily. So again, you're going to see I'm probably struggling a little bit from a mobility standpoint to get back there. So don't worry about using a heavy ball right now. Will you get a little bit of a burn in the shoulder? Yes, but I care more about us doing it right versus doing it with a lot of load. So again, I'm going to be facing forward here. My arm's back. I'm rotating up, down, rotating up, and down. Okay, so those are two exercises I like to do with pitchers to improve their hip-shoulder separation mobility. If you have any questions about either of those exercises, drop a comment below. We'll get back to you. Or you can like and subscribe to our channel. We have a ton of content put out on a weekly basis for baseball player rehab and performance training.